Hi, I'm Ed Kopetsky. What drives my passion for this work is rooted in personal tragedy, but a strong desire to help others in our health systems improve. Like so many families affected by the opioid crisis, our son suffered from addiction to opiates starting in college. After his courageous struggle over 10 years and nearly 5 years of successful recovery, we lost him to a single relapse and accidental overdose 3 years ago. We launched the Opioid Task Force 3 months later, and I'm so honored to serve as a co chair in this effort to leverage our membership and our foundation partners in developing new solutions. A great example is our Opioid Action Center, which serves as an emerging knowledge hub for leading practices and education materials, as well as advocacy. The opioid crisis has not abated, and by all measures has gotten worse through COVID. Addiction is a disease that has no boundaries. We are all impacted. I am committed to helping however I can and ask you to learn more and consider joining our efforts. Thank you very much.
The work of the Opioid Task Force comes from my personal experience. I have family and friends affected by the disease of addiction. We all seem to be touched in some way by this corrosive problem, and it can happen to anyone. Case in point, one of my dear friends, Susan, began taking pain medication for a real medical issue. She became addicted quickly. As a well-educated, professional, and world traveler with a six-figure income, she lost her job, her friends, and all her connections very quickly, finally losing her life. I hear so many stories like Susan's. Our Chime members have the right skills to make a positive impact on this problem. I love being a part of a group that is working for the betterment of our society as it relates to opioid addiction.
Hi, everybody. What drives my passion for this work? The answer is pretty easy. People are dying. And we, associated with Chime, are in a unique position to do something about it. When I first answered the call to join the Opioid Task Force, I learned this horrible statistic that more than 40,000 Americans were dying every year, more than died in the totality of the Vietnam War. I also learned of our founder, Ed Kopetsky, CIO out at Stanford Children's personal story. And the statistics and the personal connection to Chime, I knew I was all in. The other reason I have a passion for this is I'm working with 60 or 70 like-minded volunteers from both the CIO community and from the vendor commercial partner community where I come from, working together to try to genuinely make a difference. If you think about it, we sit at the intersection of care delivery and information management, and you need the info to get the care to the folks who are at most at risk. And it's hard on a day-to-day basis to hear what's going on in the world. Unfortunately, I understand that deaths from opioid addiction overdose during COVID are actually accelerating. We know clearly our work is not yet done. So off we go. Join us. We'd love to have you on board.
My name is Sean Kelly, and my passion for fighting the opioid epidemic is that I'm an emergency physician, and I see the cost of this crisis unfolding on a daily basis. Shift after shift, I see people come in the throes of addiction, either dying from or suffering in some way from opioid addiction, abuse, and fraud and diversion. We have the means to change this as technologists and clinicians. We have plenty of tools at our disposal. And I really think that together we can make a difference. And I really hope that we can continue to force multiply the effects of all the great tools that we have out there with some of the great people involved in this fight and really help people and patients, family and friends to overcome and survive this crisis.
What drives my passion for this work is the recognition that the opioid epidemic has had a devastating effect on individuals, families, and society, and knowing that I can use my experience and skills in health IT to make a difference. While progress has been made, drug overdose deaths involving prescriptions or illicit opioids continue to severely impact our country. The COVID-19 crisis has introduced stressors that have further aggravated the situation. Policy, funding, stigma, social barriers continue to stand in the way. I've heard so many stories of suffering and resilience as well as progress. It's hard not to feel a profound obligation to do what you can do to prevent and alleviate people's suffering. The CHIME Opioid Task Force members are an amazing group of people, and it has truly been a privilege. I look forward to continuing to make a difference.
The opioid crisis has presented a unique opportunity and a responsibility for we CIOs and other IT leaders to impact the communities we live in. Through education and advocacy, as well as sharing solutions to provide substance abuse information to our providers as they need it, when they need it, we can make a difference.
My passion is working with patients to alleviate pain. It is why I became a physician and why I still enjoy coming to work every day. I'm also very fortunate and lucky to be a researcher and teacher in this field. Last, getting to work with faculty, staff, trainees, and students who have the same commitment to excellence is a true honor.